Welcome to the clinical skills video for administering a subcutaneous injection. Prior to performing this procedure, you must explain to the patient what you're about to do. Also inquiring about any history of any adverse reactions or allergies to any drugs. You must ensure that you then wash your hands thoroughly using the 11-stage approach. You must then assemble the equipment required, ensuring that the tray has been thoroughly cleaned using the appropriate wipes. Confirm that you have the correct drug to be administered, that it's the correct dose, the correct route, and that it is within date. If not using a pre-filled syringe, you will need a 25 gauge needle or orange needle, an appropriate size syringe. Prepare and draw up the appropriate dose of the drug. In this case, we're using an insulin syringe, but you can also see we have an orange needle and a syringe if you were wishing to draw it up, not using this device. Select the appropriate injection site. In this case, we are using the umbilical region of the abdomen as absorption is most rapid at this site. The skin must be cleaned if not socially clean, avoiding any areas of lesion or infection. Pinch the skin upwards about 2 centimeters of thickness and insert the needle at 90 degrees for a shorter needle. If you are using a slightly larger needle, you may need to go more 45 degrees. Inject the whole drug, withdrawing slightly prior to injecting the drug to ensure that you have not hit a vessel. Once the whole drug has been administered, withdraw the needle, dispose of it appropriately in the sharps bin, or close the needle safety device if used. Apply gauze and check for bleeding or bruising before removal. Ensure that your patient is comfortable and warn of any adverse reactions and offer any appropriate advice. Ensure that after the procedure an appropriate record has been made within the patient's notes and drug administration card that the patient has received this drug. In summary, confirm your patient's identity. Ensure the patient has no known allergies and the procedure has been fully explained. Wash your hands and then assemble and prepare all drugs and equipment, ensuring an aseptic non-touch technique is maintained. Pinch the skin upwards, about 2 centimeters of the skin, and insert the needle 45 to 90 degrees, dependent on the size of the needle and the patient. Ensure that sharps and equipment is disposed of safely, that adequate aftercare advice is provided, and the correct documentation is filled out.